I'm Michelle Fox, and this is my father, Erlend. We live in Massachusetts, and my dad was recently diagnosed with CVID, common variable immune deficiency, after many years of frequent illness and a lot of time in the hospital.
Starting in very, very early childhood, back as far as I can remember, I had respiratory complications, pneumonia, double pneumonia, and all of the childhood illnesses more than once, several of them. And then just one illness after another my whole life. So by the time I was an adult and dealing with all of these post-operative infections, I've had 8 operations, and I've had a post-operative infection after every single one of them. So it's a pretty obvious track record, and it was obvious to me all these years that something was wrong. I just didn't know what. About 4.5 years ago, I had a knee replacement done, and the recovery was pretty poor for a variety of reasons, one of which was that it had become infected early on. When I was preparing to have the surgery done, I asked to have a diagnosis done because I was familiar with Michelle's history and her children's history with immune deficiency. And it seemed very likely that I was in the same boat. And the surgeon declined. He just simply figured that it wouldn't alter his treatment whether I was or not. And second of all, that if it was really severe enough to worry about, I probably wouldn't have survived at this point, given my medical history. So this past year, I finally came in to have the knee done, and the offending part was taken out, the infection was dealt with, and no one realized it was going to happen this way, but it took months and months to get rid of the infection. And all along through that, I was talking about wanting a diagnosis. And back in January, just when I was due to have the final new knee replacement done, I was hospitalized with pneumonia and sepsis. And that's when the battle to get diagnosis became a full-time job.
Especially in the last few years, watching the rapid fire of the serious surgeries and post-op infection complications and everything. It was just, and there were a couple of times that we were told not to expect good outcomes, and really worried that he was going to die waiting for a diagnosis. And then with the recent sepsis and pneumonia, it was MRSA, so it was extremely difficult to treat, and not usually a great outcome, especially for someone who's immune compromised, and it's seeded into his spine. It's caused permanent damage in his spine now that may have to be dealt with another surgery. There were many years of sort of mistrust of the medical system from what I saw, but I think it turned out you were just very discouraged from.
That was frustrating for both of us because it was a typical father-daughter miscommunication kind of thing. She would ask me to please talk to the doctor, and I would say, I have. And she would say, no, I mean really talk to him. I said, I really did. And she said, and I said, he won't listen. So I don't want to talk about it anymore. They won't listen.
I actually made him bring me to some of the visits so that I could bug him. And now all his doctors hate me. So.
Yeah, he still didn't listen, did he?
No, they didn't listen.
No. And then finally they agreed to submit to a diagnosis, and needless to say, I was found to be positive and started getting IVIG at that time, and it's just made a huge difference. I haven't had any serious illnesses since then. And it's fair to say that this is probably the first time in 20 or 30 years that I haven't had some kind of a cold or respiratory difficulty.